Hi, my name is Sherry Granader, and today I'm with Dr. Russel Jackman. You know, many of us deal with low back pain or chronic back pain. And Dr. Jackman, I'd like to ask you, when you have a patient that comes into your office that is dealing with chronic back pain, what protocols do you recommend, or what have you had success with?
Well, first, when we have chronic back pain, we're often seeing that it's osteoarthritis, which is a degeneration of the cartilage and the underlying bone. So it's something that we can't really cure, but we can sure take steps to improve it. And one of the first things that I recommend people look at is just what's going on with your lifestyle. That has to do with if you're working, are you working a sedentary job, then you need to be getting up each hour and moving. Don't sit in that one position for long periods of time. Also, the counter to that, if you're doing a job that's very repetitive, then you want to be able to give yourself rest periods from that repetitive, actually overstress of the body. So we need to look at reducing the amount of activity and increasing the amount of activity depending on what's appropriate for you. And sometimes that's the challenge, is finding the balance. But also looking at body mechanics. Are we sitting in a keyboard? How we sit at a keyboard? Are we keeping ourselves lean forward, stressing the low back? Are we lifting? Are we lifting with our knees and our body versus our low back, so that we're keeping our upper body erect and our spine straight, so that we're not just putting stressors that then are irritating day in and day out on the spine. From an approach, if I'm looking at you as a chiropractor, then I look at what's happening around that degenerative area. Is it moving in its joints the way it's supposed to? So I want to help mobilize that. Your own exercising that you do, stretching on a regular basis, helps with that. But usually you need a chiropractor to take you that one extra step to be able to get it to be mobile enough that it works more in its normal range, which means less likely to produce pain for you.
Okay, so you recommend yoga?
Oh,
finding a yoga class
yes.
that works? Okay.
I recommend any type of exercise within its limits to help with the pain. Yes, yoga, yes to walking, even yes to light weights and things like that that help support the body as a whole, not just the low back. So we're talking about helping the spine and the low back, but anything that helps the body in turn helps that pain level, especially when it's a chronic osteoarthritic type pain.
Okay. You know, and we've talked about this before on, sometimes stress and emotional issues that we're dealing with. I mean, let's face it, life is stressful, so sometimes it kind of lands in our back.
Yes.
Is that true?
Yes,
Okay.
Very much so.
Okay.
Because we like to carry our stress, and thinking about that as a low back, that we're carrying an extra weight.
Oh,
for us.
sure.
And a simple way to look at reducing stress is being able to quiet ourselves. Meditation is a form of way of quieting, but sometimes just listening to music or reading a book, anything that allows us to still our thoughts and still our body, can be quieting and give us an outlet for our stress. That exercise we just talked about too is an outlet for stress.
Okay.
And can have a stress reduction benefit for us from just doing our exercise.
Sure, we all feel better after we exercise. It's just, I think half the battle is scheduling it or getting to the gym or getting to the yoga studio. And what works for me is I schedule it. I have to schedule it. If I don't, it's like there's too many other things I can do.
Right. What's the priority?
Right.
If it's a priority, then it has to be on the list that gets above the other things on your list.
Right.
So it's actually done versus being pushed down and ignored.
All right. Well, wonderful. So to summarize, it would be exercise, finding something you can enjoy, anything you can do to de-stress the body, and just, dealing with life in general. Do all that you can do to keep your peace inside.
Yes, exactly.
Okay. Well, thank you so much.
You're welcome.